Hello everyone, my name is Rohan Shah and today I'm honored to be joined with Dr. Pavan Kumar. Dr. Pavan Kumar is a general physician at our hospital, NRI General Hospital, and recently matched in this year's cycle. Thank you for joining us, sir.
Oh, thank you, Rohan. Thank you for calling me.
So before we jump right into it, let's go a little bit on your journey. So from MBBS till matching now, how was that?
Yeah, I started my medical school in 2014 and I completed my MBBS in 2020. In 2020 itself, I just got my medical entrance and cleared it and entered into NRI Medical College in internal medicine. So I completed in 2023. In residency itself, I had a thought that why shouldn't I complete my USMLE, because it's my dream to go for US since in my first year of MBBS.
Okay.
So even though I was a good student in my MBBS itself, I got distinctions in every subject, all the 14 subjects.
Oh wow!
Yeah, and too I got medals in many subjects. I can say it first started with physiology. Oh, it driven me the passion because in first year I was a little bit clumsy which subject to start because I'm from a rural background. So in the initial days I felt a little hurdle in just understanding the subject and being equipped with the other people and everything. So physiology is the one thing which catch my attention. So it given me the passion, so it's gone from physiology to pathology and pharma. And in third year, I was a gold medalist in ENT. And these basic subjects like physio, patho and ENT, all these subjects has driven me towards I'm the gold medalist in internal medicine and the pediatrics too.
Oh my god, congratulations.
Thank you. So I always say this, why I say always students to concentrate on basic subjects because these basic subjects will form the foundation for the other subjects. So this is the little bit journey of my MBBS, and after this I complete my residency in NRI itself. After completion of the residency, just I had a thought, why should I complete my USMLE journey or why should I go for MRCP? So I had thought of many options. So initially I started with MRCP. So I just prepared for 1 month. I just had a contact with many friends there, what's going on in the UK, is it fine for everything? But I found that there are a lot of disparities in the UK healthcare system.
Yeah.
It's not suitable there because of the high cost and everything. There are many loopholes there. So I better choose not to go for London, and I started my journey for US.
So you mentioned a little bit that you're from a rural background.
Yes.
Could you go into that? Are you the first doctor in your family? Or?
Oh yeah, I need to say that I'm not the first doctor in the family itself. I'm the first doctor in my entire village.
Oh wow!
Yeah.
That's a huge step.
Yeah, thank you.
Well, they must be very proud of you. Okay, so you kind of mentioned. So when in your residency in India, those 3 years, what year did you kind of be like, I want to go to the US?
Oh yeah. In the end of the second year itself, I had the thought. I already said you I want to. I had started the journey for MRCP.
Yeah.
In second year itself, I started my journey for MRCP, but it's a very short journey. I just prepared for 2 months. That's all. I just taken that Paces app and done the stuff everything. But ongoing onwards, just I found those cons about the UK healthcare system, so I stopped there. So in third year itself, I choose that it's better if I go for US. But in third year, we only have 2 things. One, the thesis part. The other part is for preparing for the final exams because Harris and all these things are big subjects, big textbooks we need to complete. So I thought that we'll think of it after completion of my residency.
Okay. So kind of once you entered your senior residency, that's when you kind of started preparing? Or?
Oh yeah, actually I need to say that. I taken senior residency just because of this USMLE journey.
Okay.
Completion of my residency itself, I thought that why can't I prepare for the SS? But one thing I got in my mind, if I go for this super specialty, I can't complete my USMLE journey. Because every time I'm having a thought of some thought in my mind runs in says that why can't I complete my USMLE journey? Because I thought that am I inefficient or I cannot complete this journey? So I thought I should take it as a challenge. So many of my friends and my colleagues all said me one thing: are you foolish or what? Why are you like completing this journey after your completion of your MD degree? It's waste of time, like it's waste of your resources and waste of your time. But I said one thing: we can dream of anything at any point of time. So I thought maybe it's 1 year, that's fine for me. I'll complete my journey.
Okay, that's amazing. Actually, I didn't know all of this before this is great. So kind of, how did you balance that then, your senior residency and studying for USMLE both?
Oh yes, I'll say one thing. I already said about my journey in my MBBS itself. Like my footprints in MBBS, like it's all because of a well-planning system. So I should say about one professor who has trained me, given me suggestion to prepare a plan. Her name is Sunita. He is an anatomy professor. He said me in the first few days of thing, like because in the first few months they had given me exam for anatomy. I couldn't complete the exam, just went for her because like she is a good professor. Like everyone used to take the views from her, like how to prepare and all the things. Like I just went for her. She said that I'm not able to complete this thing. Then he said that it's not about the thing like you're not able to read the subject. It's because of your failure of your planning. So when you have a proper plan, you won't fail at all. When you don't have a plan, you will definitely fail. It's this line she said about me, and just said me, keep everything on a paper. When you keep everything on a paper, it will definitely show you a way. How much time you have, how much resources you have, how should you plan. This is the thing she said to me. Just I followed the same thing. It given me the wonderful results. So I can say that this is a book, like it's gifted by one of my senior. I can show you that it has every schedule. It's since my second year to all my thing, like my NEET entrance exam, everything. Like I just can say the dates, everything.
Wow.
At what dates I should read this. I just kept this book because like it gave me some inspiration for my future works. So in senior residency itself, like I thought that in the morning hours I'll dedicate everything for my patients. And in afternoon time, I'll just go for library, I'll sit and I'll read. That's all. So I planned accordingly.
Wow, that level of dedication is amazing. So a little bit about USMLE then. So what are some of the resources you would suggest for the 3 steps?
Yeah, I'll definitely say about the resources, and like I have seen some changes what's happening in these USMLE, like a questionnaire and everything. And I also say about the timeline, like when to give us step 1 and step 2 and step 3, like what should be the ideal duration between step 1 and step 2 and step 3. So I already said that it's always better to start step 1 in third year itself, at least in the middle of the third year, or like we should complete at least in the 4th year itself, so we can focus on the step 2 in the internship. So the step 1 and step 2 are something like the step 1 is something like a foundation. So they just focus on like what will be the diagnosis, something like what will be the physiological part or what will be the pathological part. The step 2 is something like that. Okay, what should be the treatment? What should be the what can be the consequences? How can we prevent the consequences? Something like that. So I always say that when you increase the gap between the step 1 and step 2, it will definitely show some bad impact on your scores.
Okay.
So it always better to give step 1 and step 2 like not so far, like not more than 6 months or 7 months. So when you cross the duration, like you will always lose the foundation of step 1. So I already said that the common resources what I have used is like the first aid for step 1 and the U-World. And for the step 2 itself, like there is first aid book. So many people doesn't know there is one book called first aid for the step 2 also. So I always suggest that there is step 2 for like first aid for step 2 also. It's a good resource, you can use that. Along with that, you can use the U-World. So in U-World also, like always suggest to do the questions in a random manner. After completion of your first go with the random things. Because like when we go from system to system, we won't get the thing, like because in the main exam itself we won't get the system wise questions. it will always be some like random questions itself. So it's always better to do random questions. The two, when doing the questions, maybe it's for step 1 or step 2, always use your leisure time. Leisure time, what I say means like if you're going for a walk or something, like you are in like doing some sort of activity, just keep it some random module for 10 or 20 questions. Why I'm saying for 10 or 20 questions means, yes, we may be focused in the main exam because we are left with no option. But in normal times, we are not much focused for doing the 40 questions, because for the first 10 questions, we'll do with the like the same sort of like time and everything. But after doing the 10 questions, we lose the interest. So okay, we'll complete the questions, but the thing is like we need to check the answers. Look, what sort of wrongs we have done, why you choose this option wrong, so something. But after doing about 10 or 15 questions, we lose the interest. So I always say that do the questions 10 or 20 questions, because there is one study which says that when we are reading, our concentrations levels will be like for 40 minutes it will be a peak, and after that it comes down. So it's always better to take after like a 1 hour break, like the breaks not exceed 5 or 10 minutes, because like when the gap increases, we lose all the interest. So read for 1 hour, take a break of 5 or 10 minutes, then the same interest levels will go. So it's always better to do 10 or 20 questions in a module.
Okay.
So you will review all the answers, and like you also get some confidence and you won't lose the interest. So the another resource is Mehlman PDFs are there, like it's also a good resource. Recent days after the Nepal incident, so there is a change in the pattern of the questions. They are focusing more on two things. One is biostats and the other one is ethics. So even the question, like they'll definitely follow, like there will be a 1 page in the score report saying that for CVS this number of questions, RS this number of questions, and like they will give some guidelines. So they will the USMLE will definitely follow the same questionnaire, but they will just frame the type of question. They will prepare a ethics based CVS question.
Okay.
So focus more on the ethics part and the biostats part, because we'll definitely read all the diseases, but we'll don't focus much on the ethics and the biostats. For biostats and ethics, I always suggest to go for AMBOS.
Okay.
AMBOS, it's a good source for the ethics and the biostats too. In UWorld, a little they are not much focused on the ethics part, so do the questions from the AMBOS. For step 2, there is one module in the AMBOS itself, the high yield 200 questions. So definitely go for the thing before going for the exam, 200 high yield topics for step 2.
Okay.
So that's the must to go. And another module in the AMBOS itself for like this thing, screening guidelines, and the other one for the vaccines. So these are the most important topics: ethics, biostatistics, screening guidelines, vaccines. And the other most important thing is dermatology.
Okay.
Yes, no one will think that dermatology is much important, but no, derma is so much important, because we'll easily confuse the thing. There are few topics which are so important from the derma, like I can say one topic like rashes in the neonates. There is a one table which is so much important, we'll definitely get a question from them.
Okay.
So there are some few topics which are so important, so something like neurofibromatosis 1, 2, 1 Hepelendo disease. All these questions are like these topics are so important. So these are the important resource, and I also suggest that always give your step 3 as early as possible, not crossing more than 2 months or 3 months, because there is 90% pass rate for the step 3.
Okay.
90%.
Wow.
Just think that it's not the same for the step 1 or step 2. 90% pass rate for non-US IMGs and 85% pass rate for the US IMGs.
Oh.
And the topics are same from the step 1 and step 2. The same screening guidelines, the same vaccines, and same everything, except the one thing is CCS cases. focus on the CCS cases. In CCS cases too, there is 100 high yield topics, high yield cases. So just done with those 100 high yield topics, done and dusted. Give your exam as early as possible from your step 2, you will definitely have a good result.
Okay. So how important is the score on step 3?
Step 3. Anyway, the score is important, but the first thing is for the main reason doing for the step 3 is 2 things. One is for the H1B visa. The other thing is we need to transition from the first year to second year. Step 3 is a must. So why the programs are so interested in picking the candidates done with step 3 is in first year we won't get much time for preparation of the step 3. Maybe we have done the step 2 in the long back, so we need to prepare all the step 2 again. So it's a start from the restart thing.
Yeah.
So we won't get much time in the first year of residency, because it will be something hectic and a new system, new place, new people and everything. So the program should give some dedicated time for your step 3. If you haven't completed your step 3, you are not allowed to go for second year. So it will always be a burden, some headache for the programs, because the residents they need to provide some dedicated time, that too out of the schedule.
Yeah.
And it will be some burdensome them too. So they always choose the candidates who have completed the step 3.
Okay.
So these are the 2 things which in H1B and the
so you
transition.
mentioned the visa. How does step 3 I didn't get that point. How does step 3?
Oh yeah. For non-US IMGs, there are 2 types of visas. One is J1 visa and the other one is H1B visa. So there are pros for the J1 visa and the pros for the H1B visa too. So for H1B visa, we need to complete our step 3.
Okay.
For J1, there is no such requirement. We need step 3 during the transition from first year to second year.
Okay.
Yeah. So the one pro for the J1 visa is after completion of a residency, many programs will offer J1. Fellowship offering programs most of the programs are J1.
Okay.
So it's easy to secure the fellowship with J1 visa. The other part for H1B is you already know, it's a easy path for green card.
Okay.
So there's some pros and cons. So it depends on your program and the other things too.
Oh. So, but if we're going for rotations, B1, B2 is still the...
Oh yes. So I said about the type of visas for the residency, but for entering the US, there may be a number of visas. The basic one we use for rotations is B1 and B2.
Okay, and so kind of for the interview process on B1, B2, what do you go in telling them? I know sometimes you can't, there's a lot of restrictions and stuff. So kind of what did you list as your purpose to go to the US? Oh
yes, for entering the US, the first thing is we need to be truthful. So just say what is your original purpose of going. And we should make our documents good documents, means while securing the letter of recommendation or some invitation, letter of invitation. So for going for US, we have 2 purposes. One may be the business and one is leisure purpose. So the other, so we need to specify the reason. What is the purpose of a visit, a visit to going for the US? Most of the people will take the visas for doing the rotations.
Yeah.
So first we need to acquire a letter of recommendation. So always take a letter of recommendation from the good programs.
Okay.
So it's just if the letter is not the clear one, even if a physician is having paid much attention to that thing, it will be definitely rejected, because they'll definitely check what's going on, whether the physician is working in that hospital or not, what is his background, everything they'll definitely check. So after checking it only, they will definitely issue.
Okay.
So we need to specify our income sources too. Because most of the people who are going for the US for doing rotations, they may be interns or maybe in their 3rd year or 4th year.
Yeah.
So they definitely show the source of income. If they show the source of income and a letter of invitation for the programs, they will definitely accept. But be sure that acquire a good one, because like if you are rejected once, it will definitely increase the chances for going the rejection again.
Okay.
Yeah.
So you're saying we apply for our rotations, get acceptance, get a letter of invitation, and then we approach the visa process with that letter.
Yes. We need, because like there will always be many programs offer the observerships and everything, so maybe the rotations and everything, but we need to get contact with them. We need to send emails, or like we need to contact the program like maybe 6 months prior or 7 months prior, because like they will always start the boarding process 5 to 6 months before.
Okay.
So if you are like left with only 1 month time or 2 months time, like they won't do that until unless you have a good contacts, maybe your relatives or someone who is working there, who will give us some word about you. The context will definitely matter.
Okay. And so you mentioned observerships. So observerships versus rotations. So once you clear medical school,
Yes. The thing is like observerships, like the US healthcare system will definitely invite the students like for the rotations and giving the knowledge about the US healthcare system, but not at the risk of the patient.
Yeah.
So medical students can do mistakes. That's okay. In India or in US or any healthcare system, that's okay. That's the responsibility of the consultant who needs to check on the student. But once you have completed your medical degree, like you complete your internship and everything, like it's done and dusted. They won't take the risk. Then you can't touch the patient. It's just the observership. So you will go, you will observe the patient, you will follow the consultant, that's all. You won't touch the patient and you won't do the other things.
Okay, so it's definitely more beneficial to do the rotations.
Yeah, it's always better to keep at least a 1 week or 2 weeks left in your like internship or anything before completion. Don't acquire the degree, because like instead of the observership, the clerkships are way better.
So while you're applying for residency in this whole USMLE journey, it's a very long journey.
Yes.
So what were some of the biggest challenges you faced coming from senior residency in India?
The main thing is like everyone will say that okay, you completed your general medicine, so it's very easy for you. It's like a cakewalk to do all the things, like it is easy stuff. I say that yeah, it's a different from like from the UG students, but it's also different from the PG students. But we won't read all the stuff, like we don't read the ethics, we don't go for biostats, and I can say about this biochemistry and everything. We just read biochemistry for a few days in the first year itself. How can we remember all those things? I just felt a little bit hard in the initial days.
So then once we've passed step 1, step 2, and now rotations, so how many rotations should we target before applying for the match?
Yeah, in my application, like I done my things like step 1, step 2, step 3, and these rotations in a very hurry, like in a compacted way. So I have only time for doing 3 rotations. So I always say it's always better to have as many as USC as possible. If you have a lot of time, 6 is very good, because the US people will definitely look out at our application and see like how much US clinical experience he had, like he has the touch with the system, does he know the culture of a system. So it's always better to have as many USC as possible, but I'll definitely say 3 is minimum, 6 is a very good one.
Okay. So you kind of mentioned about the culture in the US. So how was that adjusting, coming from India and going and adjusting to that kind of culture?
Yes, the cultural barrier will be definitely like it will be a difficult thing in the initial part of days, because in India taking consents is a different thing. We always thought that consent is implied. Just if you are going to examine, just I'll say a scenario. Maybe you are taking some case from a patient in the wards itself. You'll directly go the thing and just you'll ask the questions in India. You might have experience in the wards itself, but if it happens in the same US, like definitely will be get scolded. Like we need to first ask the consent of the patient. Can I have a history of yourself? Can I touch you? And like can I have the vitals? We'll ask consent for everything in US, but it doesn't happen in the Indian system itself. Yes, we need to take the consent in India itself, but we won't do that thing because we always thought that it's granted.
Yeah.
So it's the first cultural barrier what I have experienced.
Okay, that makes sense. So then kind of, let's say outside of the medical side in the US, just daily life there, staying there for how many months you did. How was that experience for you?
Yeah, I stayed for nearly 5 months there in US. It will definitely be difficult for us Indians, because like in India will always be at home, like our mother prepares our food for ourselves, and like someone will wash our clothes, and like someone will do work for us. But in US it's definitely a different system. We need to do our works. We need to like allocate some time for doing our daily activities, for cooking, and some time for like reading, and some time for going for the rotations and everything. So it will be difficult, but like we'll know about ourselves, like what we can do. We can become a cook there. We can, yes, we'll do experiment a lot of things there. Like it's a nice culture and like nice environment too. It's good.
So then about the food now, I've lived in US my whole life, so fast food culture there is huge. How was adjusting to the food in the US and all that?
Yeah, like in the initial days, like it's good to have some sandwiches and burgers, but like always like we South Indians will definitely have some like the love for the rice. So at the end of the day, we'll be having good thing like after like good mood after having rice itself. So it's okay to have the burger and sandwich for now and then, but we won't be happy until unless we have the rice.
How did your experiences practicing medicine in the US kind of translate to your rotations and your application process for USMLE?
Oh yes. The knowledge what I have gained in Indian health system has helped me a lot in the US healthcare system, because maybe the region changes but the disease won't change. The same sort of principle, like we also follow the same like the English healthcare system, means like the same textbooks what they are following and the same things we are following too. Maybe the pattern of disease changes but the disease doesn't change. So I just like lack a few things like screening guidelines and the vaccination protocols. These are the things like which I felt difficult there, because like we don't have such things happening in India. We just mainly focus on one thing, treating the disease, that's all, at a very minimal cost. So it's the main role here. So but in US, like its most important thing is we need to fully treat the patient. We need to find the disease, like how much costly it is, like we'll send all the investigations. So I seen a one case there. Is 45-year-old male patient. He got like with chest pain and everything. So the same scenario when it happens in India, we can't diagnose the disease. So that patient has amyloidosis, restrictive cardiomyopathy. They have used PYR scan. So I never had that type of scan in India. That's the first thing like what I had, like what is the PYR scan? Like it's a scan used for the restrictive cardiomyopathy, that too for the amyloidosis. Like I was shocked. Oh, this much of things are going on in US. Like we are still like lacking those things. We are just mainly focusing on one thing. We'll find the same diagnosis using the ECG.
Okay.
And 2D echo.
Okay, that's amazing. So then, let's say I'm a postgraduate or I'm a medical student, and I'm kind of contemplating, do I want to go to the USMLE route or India PG route? What would you kind of advise them?
So it's depend on yourself. Like what do you want from residency in India or US? Like what are your things? Like what are your needs? Like the thing is, like it depends on you. What do you want from the medicine in India, or like what do you want from US? So you need to think about yourself. Like okay, because like I'm not criticizing India or I'm not criticizing in USA. Every place has some pros and every place has some cons. So you need to decide yourself, like which system you are going to fit. I thought that like I already experienced the Indian system. Now I want to experiment on the US healthcare system.
Okay, so now beyond kind of your residency, so are you fixed on settling in the US, or you're not sure yet, or is that something you've given thought to?
Yeah, I thought that maybe for few years I want to stay in US. Like I haven't still decided to come back to India or not. Like first I want to I want to experience the system, how it's going on US. Then only I can decide.
Okay, yeah, that makes sense. So then, kind of you matched into general medicine in the US, and you also went to general medicine in India. So what kind of drew you towards medicine rather than maybe some surgical branch?
Oh yes, like it always started in my MBBS itself. Like when I'm doing my final year itself, like I say, two personalities I met in my medicine, and also in the another personality in surgery. Like all these persons like given me the insights what's happening in the medicine. The first person is like his name is also Pavan. Like he's a resident. Like when I was in the second year itself, he's a first year PG. He taught us medicine in the wards like very nice. Like I just like driven by his the way of teaching. And the other person is Ashwini Kumar sir. Like he's also a senior most professor in our college. He always teaches the medicine with empathy. These are the two personalities which driven me towards the medicine. But the main thing is I always has an interest something like I always like the suspense thrillers. I just want to investigate something. So I'm so curious that even that this is I just want to say one thing. It's something like an investigative job, medicine. So we need to find who is the culprit, and we need to think like what we can do to stop the culprit. So I was so much curious about the medicine.
Okay, well that's great. So kind of going like a bit hyper focused now. So in the interviews, so what kind of questions can you expect on like the USMLE interviews, those kind of things?
Oh, okay. So is it pertinent? It's the common questions, or like is it pertaining to Indian residency?
Well, I say a combination of both.
Okay. So the first thing what they will ask is tell me about yourself.
Mm-hmm.
The common question like every interviewer will ask is tell me about yourself. Mm-hmm. The first they will start with that thing. The other thing, they will look at our CV. Before coming the interview itself, they will have a like for every interview session, there may be 5 to 10 persons. So and the board will be having 3 to 4 persons. Mm-hmm. Every person will review our applications and the LORs. We'll keep some experiences. They mainly focus on 10 experiences. So most of the people will keep the 10 out of 10 experiences. They will catch the thing which are relevant to our medicine.
Okay.
So we will keep a volunteership or anything, but always like I seen that they are asking questions mainly for the things which are related to our profession.
Okay.
And the other thing, they will always look after the LORs, and they will ask the things what we have mentioned in the LOR itself. Mm-hmm. Okay, just I can say one thing. I did rotation in Houston Methodist. In the LOR itself, like the program director has written me about the cases what I have seen there. It's about a case like AKA in kidney transplant cases. Just he asked me like what's so specific about that AKA in kidney transplant patient. So I just like explained what we have like done the things. If you don't say the things what you have done there, you will be get caught and it's done. So they'll use the confidence itself. Okay, this person has like keeping the wrong things in the LOR and which he haven't done. So just we shouldn't focus on this application. Just rule out this application. Yeah. And that's the first question. Like tell me about yourself, and they will ask you about the experiences what we have in our medical journey, and they will definitely give the ethical questions. So okay, they will create a scenario. Okay, you are in some sort of situation, you have some doubt with your colleague, or you are not trusting your colleague, so what do you do in this scenario? Or yes, you have some objection with your seniors, like what do you do in that scenario? They always go for the ethics things.
Okay. I think that also kind of contrasts the US and Indian healthcare systems.
Definitely.
Ethics is a huge part of it.